Heading further, our next speaker is Dr. Mihirdev Zala, who is the principal of JG College of Physiotherapy located at Ahmedabad. He is MPT Neuro Guide and also a PhD scholar. He has published various national and international papers. He has keen interest in research and also believes in approaching the patient practically. He is a great sport enthusiast, which also defines an add-on quality to a true physiotherapy professional. I would once again like to invite Dr. Mihirdev Zala on the dais.
Good afternoon to one and all present here. First of all, I like to thank Dr. Mohal Banker sir, Dr. 𝙂𝙧𝙚𝙧𝙗𝙗 for the invitation. As Dr. 𝙀𝙧𝙗𝙗 has already said about the anatomy and the clinical features of the lateral epicondylitis, or that's a tennis elbow, I'll not waste much of the time on that. Rather, I'll be starting then with the brief introduction of the condition and then a brief physiotherapy management. As you all know, it's a pathological condition of the common extensor muscles at their origin on the lateral humeral epicondyle. And it's tendinosis of extensor carpi radialis brevis, and sometimes also extensor carpi radialis longus is also involved in this condition. And the other terminology of tennis elbow is usually lateral epicondylitis 2. You can see the extensor origin there, it takes place, the inflammation and then tendinosis, and then later, as Dr. 𝙀𝙧𝙗𝙗 said, tear can also occur if not treated on time. So usual causes are repetitive stress injuries, that is overuse injuries, and the usual age we find this condition is in 35 to 55 years of age, and males and females both are usually equally affected in this condition. Depending on their occupation, the technicians, the mechanics are usually affected. The sports persons, especially the tennis players, are usually affected with this condition. As you all know, Sachin Tendulkar, a well-known cricketer, he also suffered from this condition, and it took a bit long for the recovery in tennis elbow. Symptoms usually diffuse pain on the lateral aspect of the elbow, morning stiffness, dropping of the objects because of the weakness in the grip, soreness of the forearm because the pain radiates usually from the lateral epicondyle region to the forearm also at many of the times, tenderness over the bone on the outer side of the elbow. On palpation there will be tenderness too. Now the main part, how to treat this condition. What is the physiotherapy management? So usually I have accumulated few techniques. Those are usually practiced in the physiotherapy clinic. Those are manual techniques as well as some electro modalities are used to treat this condition. What are our goals? First of all, as a physiotherapist, to control the pain, to decrease the pain so that the patient can focus in his daily activities, his occupation, his work life easily. Second, encourage the healing process. It's must, because even with the exercises or the mobilization, manipulation we give, if proper rest is not given, then the healing process will not occur and ultimately the patient will go home with more pain. The third one, restoration of flexibility and strength. And the last one, gradual return to the activity and the work. To reduce pain, usually we prefer in the acute pain, usually tendonitis is there or any inflammation is there, we prefer giving the ice massage over the lateral epicondyle region over the extensor origin muscles. Electrotherapeutic modalities such as ultrasound, laser, high voltage galvanic stimulation are usually given. Ultrasound, it helps in repair also. The evidences say it helps in regeneration and repair process too. And laser and high voltage galvanic stimulation will reduce pain too. Heat retaining brace such as neoprene sleeve worn during the rehabilitation process will improve the healing process and repair process too, because it distributes the force during the exercises in a proper way, that not only the stress has been given to the extensor origin, but it redistributes the force among the soft tissues around the elbow. For the sports players, usually as seen in the picture, counter force bracing is given to reduce the forces on the extensor tendons. Transverse friction massage, that's a soft tissue therapy over tight or thickened tissues in this position as shown in the picture could be given to the individual suffering from this condition. It will allow to decrease the adhesion formations which is usually seen in the chronic phase. Sustained longitudinal pressure on the ECRB, extensor carpi radialis brevis muscle in the position that where the elbow is fully extended and the wrist is flexed. This is given as a part of the physiotherapy rehab program. The next one is digital ischemic pressure to deep muscles. Fibers in the shortened position is given, that is to brachioradialis, extensor carpi radialis ulnaris, extensor digitorum, extensor digiti minimi, ECRB as well as ECRL. In this shortened position, it is given usually. It's a deep digital ischemic pressure. It says it will reduce some inflammation and it will reduce the pain thereby. Stretching of the ECRB is of utmost importance in this condition, as ECRB is the most prone muscle to get affected in this condition. So this is how the position, the shoulder is in bit of scaption and abduction, and elbow is in full extension and wrist goes into flexion. This is how, in the forearm is in pronated position, this is how ECRB is stretched and it helps. A technique called a cervical neural stretch. It's nothing but it's just same thing as we do in neural tension tests. It is used as a rehabilitative procedure where it is says that at a spinal level the pain decreases. There's a modulation of pain if we sensitize the nerve. So cervical neural stretch is important to reduce the pain at times. The taping technique, as you have seen many sports players doing the taping, the specific diamond taping method is used to decrease the pain in this condition. Even while playing the sports also, this kind of taping helps to an individual to decrease the damage and to decrease the discomfort during the sport. Now later on, once the pain subsides, when the recovery phase is going on, inflammation is decreased, thereby one can start the strengthening process also. So this is the ideal position where the shoulder is supported, elbow is supported, forearm is supported and the wrist is outside. With the help of some weight or dumbbells, gradual strengthening could be started with wrist extension and flexion, so that the isometric we should start, then followed by eccentric and concentric contractions of the muscles will usually help to strengthen the extensors and flexors both. The two evidences I have generated in this condition from the database. One is celiac physiotherapy. Usually celiac is given a process called as Mills maneuver, which not only alone but with deep transverse friction massage could be of useful in this condition. The evidence shows that it helps in reducing pain and it helps in recovering from this condition. The second one is mobilization with movement, that is a Mulligan technique with exercise. The second one, corticosteroid injection only, and then the third approach was wait and watch for the tennis elbow. So the physiotherapy combining elbow manipulation and exercise has superior benefit to wait and see in first 6 weeks and to corticosteroid injections after 6 weeks. So ultimately physiotherapy with some exercises is useful in this condition along with medical management on time. Thank you so much.
Thank you, Dr. Mihirdev Zala, for such an informative session. I would like to invite Dr. Rosal Gandhi along with Hitesh to felicitate Dr. Mihirdev Zala.